Mark Bor is no longer in charge at the Afi House, his position having been taken by Dr. Nicholas Muraguri. 4 years ago, on the morning of June 27, 2013, he signed a CBA on behalf of the Ministry of Health, binding the government to a collective bargaining agreement with the KMPDU.
Although it substantially meant there was progress in discussions, was not the final document that would be submitted for registration. The final document would emerge only after the Ministry of Health has properly constituted with the permanent secretary and the cabinet secretary. It would only be that ministry would own it and finalize the negotiations. As you can see, Mr. Chairman, Honorable Chairman, the Ministry of Public Health had no more capacity to negotiate on anything. It had already died. It had been consumed by the Ministry of Health.
Though his signature was as Permanent Secretary, Ministry of Public Health, the document was signed under a new regime at the Ministry of Health. Both his title and the ministry were non-existent.
The Secretary already appointed, and there were issues that had to be handed over by myself, which were pending there, and this included the issue of the human resource and the contentious issues that were bedeviling the ministry.
Bor's statement threw things into disarray with the legislators, questioning the legality of the document.
At what point did the breakdown of utmost good faith take place? That is what takes us forward in trying to arbitrate these issues between the union and the government. So it's very important that the resultant answers that you're going to give are going to shed light into that.
But the fact that you signed the document, Mr. Bor, makes it Kenyans are dying not because of doctors, but because of you, because of your signature.
He himself could not really explain why things happened the way they did, prompting the chair to term him a hostile witness.
Because actually he refused to respond to the questions that we've asked him. And because of that, we'll ask you to leave, because you've taken so much of our time and actually answered nothing.
Despite calling health sector crisis stakeholders to discuss the petition by the doctors, the meeting focused on the CBA, which many refused to acknowledge.
Kept on going around saying that this was a preliminary document.
That this document that we have, that is the basis of all the dispute, that is even the basis of the dispute in cost, that is the basis of even the salaries, is a fraudulent document.
The SRC and the PSC both raising their concern over the document.
The executive order was out, people have been appointed, and the PS at that particular time was PS Sigor, Professor Sigor, and I really cannot understand, maybe PS Bor told you why. If there's anybody who held a gun or something for him to sign, I don't know.
The current leadership at the Ministry of Health stating that no matter what happened with the signing of the CBA, the document has other pending issues. Leila Mohammed, NTV.